Namaste. This is Dr. Chitra Setya. I'm heading the Department of Obstetrics and Gynaecology at Apollo Hospitals, Noida. This is a breast cancer awareness month. So it is very important to all of us to know how do you prevent breast cancer and how do you diagnose breast cancer. The major thing is prevention, and if we know how to prevent it, we will be able to go about and do it. The major factor is that in India, breast cancer has a very high prevalence, and that is because of a lack of awareness of patients who do not know how to check themselves itself and how often should they check themselves, how to go about it, and when to go and consult a doctor and which doctor to see. As far as breast is concerned, I think most people prefer a woman doctor, so they first go to a gynecologist to check whatever is anything wrong with their breast. So, and it's very important to know that if we can diagnose breast cancer very early, the cure rate is almost 99%. And we have so many breast cancer patients who are alive, going around their natural, normal functions in life. And so many famous people have been diagnosed with breast cancer, have recovered from it, and are going on with life. So first of all, what are the factors which make us more vulnerable to breast cancer? First of all is lifestyle, obesity, which is rising in the youngsters of today. Then if there is a maternal side, on the maternal side, if there is a risk of breast cancer, if someone in your mother, your grandmother, your masi, any one of them have had it, then you do have an increased chance, so you should go for breast cancer detection earlier. Thirdly, if anyone in the family has had it or immediate mother has it, you can go for a genetic testing with BRCA1 and BRCA2 to diagnose if there is a possibility of having breast cancer in the near future or any time in life. Thirdly, your screening modality should be faster and sooner and more often. Like we say that after the age of 40, you should get your ultrasound breast and a mammogram done. Mammogram maybe every 2 years and an ultrasound breast yearly to rule out anything. And here, women in India do not go for their prevention checkups. And all the hospitals like Apollo has a medical health checkup. So all you need to do is come yearly for a checkup, which checks your whole blood tests, your ultrasound breast, ultrasound pelvis, and a mammography, which is done normally also. Another thing is that the more you are exposed to estrogen, that gives you more of a probability of breast cancer. And this risk of estrogen has increased in the recent years because children are having menarche or periods starting very early in life. By 9, 10, we are having kids who have started their periods. Also, menopause has become late. It is an average age is about 50 years and it's up to 54, 55. We are getting patients who are still having normal periods. So it's a very large time. Earlier in our generation itself, I mean, I am approaching 70, so our generation was a whole generation beyond yours. So in our generation, the period started around 13, 14 was the earliest when periods started, and menopause occurred around 45 to 46 years. Now the whole thing has widened, so you have menarche earlier and you have menopause later. Secondly, people are planning pregnancies very late. So the age at which you have your first child gives you a larger area of more of estrogen exposure, and that leads to an increased incidence of breast cancer. Also late menopause. Secondly, also that there are fewer number of children born, there is fewer lactation. Now all these things, when you're pregnant, your estrogen levels go down, progesterone levels go up. If you're lactating, again your progesterone level is going up and your estrogen is coming down. And the number of children you have, at least have 2 children and have your pregnancy slightly earlier. because you can settle in life anytime later, but all these dangers increase of abnormal children, of infertility, breast cancer. This is also one cause of breast cancer. So then alcohol, smoking. These are social evils which have come in now. Then Western diet. It is always said that eat what your grandmother ate. That is best for your genetic constitution. As far as the Asian constitution is concerned, what our grandmothers ate was healthy for us. Not following the Western diet, which has a lot of cheese, has a lot of chocolates, has a lot of fat in them. So all this also leads to an increased chances of breast cancer, and India has a very high rate of breast cancer. Okay, now how do we go about prevention? I've told you about annual checkups, but one very important thing is a self-breast examination, and that you can do monthly, or even those who are at a higher risk can do it almost every 15 days. All you need to do is stand in front of the mirror, first with the hands down, then with both the hands up, and then sort of bending forwards. Look at yourself in the mirror. Look, compare the two breasts. Is there any difference in the size? Is there any retraction of the nipple? Is there any discharge from the nipple which is abnormal? Or can you see any lump over there? This is your visual appreciation. Secondly is the palpation, self-examination. Imagine that this is the breast. Okay, this is your left breast. So raise your hand above the head so that your hand is lifted up. With the right hand, divide the breast into 4 quadrants. Use these 3 fingers and palpate the breast like this. Never palpate the breast like this. This way, you will always feel lumps. So what you're supposed to do is divide the breast into 4 quadrants. Each quadrant, you palpate it like this. Once superficially, so that you look for any superficial lumps, then slightly with more pressure, so that you can feel any deeper lumps in them. Press the nipples and see if there is any discharge. Also, there is an axillary tail of the breast. Like if this is the left side, this is the left side of the breast, then towards this side, towards your axilla, towards your armpit, there is also an axillary tail which has the lymph nodes, which are the sentinels or the sipahis of the breast tissue. Anything abnormal in the breast, there can be some sentinels which are more active, which are like your sipahis in the security guards. They are your security guard. They become active before something is actually seen in the breast also. So if there is a lump felt here in this area, so every breast is something like this with a tail like this side. It's somewhat, this way. Okay, so you feel this tail also of the breast before you palpate. And if it's on the other side, lift this hand up and palpate with the left hand, again into 4 quadrants. If you see any puckering of the nipple, if you feel a retraction of the nipple, if you feel a lump in the nipple, go and meet your gynecologist, your surgeon, somebody. Please go and meet them. Because the first thing we will do is get an ultrasound done to see if it is there. Most of the time, the lumps may be just benign fibroadenomas or a lipoma, or it may be just mild infection. But till you know what it is, till your doctor has seen it and diagnosed it with an ultrasound, you don't know what it is. Don't ignore any lump, any abnormality in your breast. So the investigations which are done is the ultrasound, the mammography, sometimes an MRI of the breast is done, thermography, all the other things. But first of all is your self-examination. You're going to your doctor as early as possible and find out that your breast lumps have to be treated. Just remember one thing, that nothing abnormal in your breast should be ignored. Whether it's a lump, whether it's a retraction, whether it's a discharge, whether it's a redness. No lump needs to be ignored. And the first thing you do when you discover anything abnormal with yourself, whatever the age, because this can happen in adolescence, it can happen in youth, it can happen in middle age, and the maximum incidence is between 40 to 50 years, with it peaking at 50 to 64 years. So all these ages, please tell your daughters, whoever you have, tell your mothers to have a checkup on your breast, self-examination. Go for an annual checkup. After 40, definitely an annual checkup is warranted. Otherwise, just self-examine, and anything abnormal with your breast, please go consult your doctor, and be very satisfied that an early detection, nothing will go wrong, and you can get cured very easily. Namaste.